I've been asked, what's the difference between NMR and NKT? Fair question. First of all, NMR is taught in a very structured way. It gives protocols to adjust common problems, and it has an emphasis on precision in muscle testing. If one is in a hurry using muscle testing to assess a problem, the body that you're working on will probably effectively fool you, because the body hates to be put in a position where it isn't going to function. And it knows as soon as you approach that alignment for that position that it isn't going to be able to respond. So it quickly adapts. And that is one of the things we go over in class, so that one can develop an awareness of how to keep your mind on noticing what's actually going on with the person that you're testing. NMR also works with a global perspective at all times, a very 3D appreciation of the biomechanics of the body. The other thing that I should say about neuromuscular reprogramming is it starts with preparing the body to benefit from corrective body work. There are lots of different kinds of corrective body work, and the one thing that has been missing in corrective body work, and the reason that a lot of people don't get better, even though they're doing all the exercises that you gave them to do and that they've been given to do, is that their body is actually not able to heal or build muscle. And that's because the sympathetic nervous system, in an accident or a trauma event, and some of those trauma events are as old as 20, 30 years. So you need to correct first, you need to test first to find out if the body is in a condition to be able to learn new strategies. These corrective protocols are a way of teaching a body new tricks. Our strategy with NMR is always to build big muscle support in order to provide the structural stability for the body before digging into the details. So this is actually extremely important in terms of a safe approach to making changes in someone's body, because NMR and NKT both have the ability to make significant change in the function of a joint. When you're working with athletes, you don't want to be changing function without being extremely thorough and meticulous in arriving at a better strategy and leaving the person you're working with in a better position to function going out the door. So I'm not exactly the best person to define what's the difference between NMR and NKT. Everybody brings something new to the work as they evolve in their own practice. I met David Weinstock back in 1987, and I was teaching a class in which the style of neuromuscular reprogramming was being presented to practitioners, and invited him to participate in the class. Subsequent to that, David became a teacher at my school, and he taught for my school for 20 years. He taught a bunch of different things that he was very well educated in, and at some point he also became one of the teaching team for neuromuscular reprogramming. So he taught on the neuromuscular reprogramming teaching team for 20 years, and then he went off and created NeuroKinetic therapy. So David taught on the teaching team at my school for so long that he doesn't remember that he was not the originator of the work. And I do hear via the grapevine that he tells people that he was one of the people who created this piece of work, which isn't actually true. He created NeuroKinetic therapy, which is David Weinstock's work.